Hi, very good morning and welcome once again to Moorgate Andrology. Today I want to ask the question many guys ask: does Peyronie's disease go away? Does Peyronie's disease go away? Now, if you've been diagnosed with Peyronie's disease, then you will have a problem with a curvature of your penis. And this curvature you may be seeing getting worse, which is why you're probably raising that question: does Peyronie's disease go away? Because you can see this bending happening over a period of time. It seems to be getting worse and worse and worse. And there could be a point at which the penis is so bent that it's impossible for you to have sexual intercourse. And this is a really debilitating condition. At first, you may notice some pain or discomfort when you get an erection, as the tissues are stretched and this curvature starts as a result of this what's called plaque or scar tissue that's caused by the inflammation in your penis. And when you get to this point, you could be wondering, is this ever going to go away? What should I do? Well, if you first notice pain in your penis, whatever cause, this should always be investigated. And pain or discomfort on erection is one of the features of Peyronie's disease. So if you have got any kind of pain in your penis, then you should seek help from either your GP or a urologist, and this can be investigated. If later you start to notice this bending, then it's highly likely you have Peyronie's disease, which would have been caused by some sort of trauma, some sort of injury to your penis some time ago. Now, lots of men can remember an incident. They'll say, oh yeah, I remember the penis suddenly bent and I felt a pop and so on. But lots of guys can't. They can't remember any kind of incident that could have caused this trauma, but nonetheless, they have this curvature, and this curvature is getting worse. Now, the great news is Peyronie's disease can be very successfully treated. You may find that in the first few months, when it's going through what's called an acute phase, when you've got this pain, you may be prescribed medication to help with erections and also a penis pump. But later on, at around maybe 12 months, or when the condition stabilizes, when you haven't noticed any change in this curvature for about 3 months, it may be possible to investigate the possibility of a minor surgical procedure to straighten your penis. And there are options out there to do this. The procedure on the National Health Service is called a Nesbit procedure, and this will straighten your penis. However, if you imagine your curvature, you'll notice that you have a shorter side and you have a longer side of this curvature. And the Nesbit operates on the longer side of your penis, which will straighten it but shorten it. And the penis is shorter by about 1 to 1.5 inches. Now, if this doesn't bother you, that's absolutely fine. That's something you can get on the National Health Service. If you approach your GP, you'll get referred to a urologist, and this procedure can be done. However, if you don't like the idea of having a penis which is much shorter than it is now, there is another technique to straighten your penis once again, but also preserve your length. And this is a procedure called plaque incision and grafting. And in this procedure, instead of operating on the longer side, we operate on the shorter side, so that when we open the penis up, we put a graft where this scar tissue is, where this plaque is. And this graft acts as a scaffold for the building of new collagen in your penis again. But this technique will preserve its length, so your penis won't end up as short as the shorter side of the penis. It will end up the same size as the longer side of your penis. Hence, plaque incision and grafting is a length preserving procedure. So I hope that answers the question, does Peyronie's disease go away? Yes, it can go away. You'll need some help for it to do so, but it can be successfully treated. So if you want to know more about Peyronie's disease and the treatments on offer, please do get in touch with us here at Moorgate Andrology. We can arrange a consultation with one of our urologists for you, and we can take things from there. That's all from me today. I'll look forward to seeing you here at Moorgate very soon. Until then, bye for now.